Hi, my name is Katie. I'm an occupational therapist and a lymphedema specialist who also specializes in lipedema, oncology rehab, and post-cosmetic therapy. Today I want to talk about a topic that comes up frequently in the clinic, and that is people who have lipedema and GLP-1 medications. So when we talk about GLP-1 medications, we're using a wide group of medications that are used to help lose weight, manage diabetes. Now there's so many other ways that people are using these drugs. However, from a lymphedema specialist standpoint, there's a few things that I want to teach my patients and educate others on when having lipedema and taking a GLP-1 medication. So from my standpoint, I really want to make sure that my patients are re-measuring or reassessing their compression garments. So people who are actively losing weight on the GLP-1 medications, they're getting smaller. And when we change, whether smaller or bigger, our compression garments no longer fit properly. So if you are one of those people who are losing weight, it's important that you re-measure yourself for compression garments, and maybe every month or so. It doesn't have to be every week, but just to make sure that you're in the right compression. Because when compression doesn't fit properly, it's not working properly. And I can always tell if a compression garment fits properly in the clinic. I tug, I look when it's on my patients, but when we're looking at the measurements of the sizing, we can also determine if that garment fits properly. Because sometimes when we wear these compression garments every day, it just feels like our normal compression, and it's easy to no longer fit in those compression garments if you're not measuring yourself. So another reason or another topic that I talk to my patients about is making sure we're doing exercise. So again, these weight loss medications are helping people lose weight, which is great. However, when you're losing weight, you're also losing muscle mass. And so you have to be able to strengthen your body to hopefully decrease how much muscle mass you're losing. So you're losing weight, which is wonderful. You're losing fat, you're losing water, but you're also losing muscle. So making sure that you do a strengthening program for the legs, the arms, the core is so important, so that way that you don't become weak. And the third thing that I like to talk to my patients about when on the weight loss medications who have lipedema is you may notice that you can palpate or feel the lipedema nodules more than before you started taking that medication. And here's why, is because if you are losing weight on these medications, you're not having as much normal fat tissue to hide the nodules. So when you go to feel the back of your arms, you may say, oh my gosh, there's so many more. Or you feel, your hips or the inside of your knees, and you may notice more nodules. All this means is that you have taken off the normal fat tissue, and that lipedema tissue is still there, so that you're feeling, you're seeing, you're palpating all the nodules that have always been there. It's not increasing, it just makes it closer to the surface. So lots of exciting things about these medications. Whether these are the right fit for you or not is something that you need to have with your doctor. But in the clinic, like I said, a lot of my patients are on different brands. Some are on the compound, some are on the name brand. Dosage is all different. So I can't keep it straight from patient to patient, but these are the recommendations that I recommend for all of my patients who are on GLP-1 drugs is we've got to make sure your compression still fits, especially if you're losing. Sometimes patients won't be losing a lot of weight. They just start to feel better with less inflammation. Those patients I'm not too concerned about with compression garments, but it's still something to keep an eye on. Number 2 is strengthening. You have to be working on building that muscle strength, because as you're losing weight, you're also losing muscle mass. So we really have to rebuild that strengthening. And number 3, just a heads up, you may feel more of the lipedema nodules than you did before. And it's not increasing, it's not getting worse, the disease isn't progressing. It's just they're more close to the surface because you've lost normal fat tissue. And so you're feeling it, you're seeing it more, but it's not getting worse.